Paul is a consultant anaesthetist at Guy's and St Thomas's NHS Foundation Trust. Guy's and St Thomas's is, of course, the regional hub for London for the Institute of Health and Social Care Management. This, I'm telling you now, is a box office presentation delivered by Paul. This is all about how we understand critical incidents through human factors. So, Paul, if I may hand over to you, and just to let you know, your hard stop here is 12:35 when it's lunchtime. Okay.
Give me a kick if I'm running over. Thank you. Thank you for the opportunity to speak about this. I wear a lot of different hats at work. So as you've heard, I'm a consultant anaesthetist. So as a frontline clinician, I can be and have been involved directly in critical incidents. I also have a role in the investigation of incidents and a managerial aspect where I'm reviewing reports that other people have written and thinking about how to implement recommendations from them. And I think wherever you are along that spectrum, it's useful to have an understanding about what human factors can contribute to investigations and to recommendations. And it's all about focusing on the system rather than the individual. And to try and illustrate that concept a little bit for you, we're going to investigate a critical incident together. But recognizing that we're all from very different disciplines and different professional backgrounds, we're not going to investigate a clinical problem. We're actually going to investigate something that happened at the Oscars a few years ago. And some of you might remember what happened. Doesn't matter if you don't, because we're going to play the incident in real time and let you see exactly what happened. So the video that we're going to play you in a moment is the award being given for the Best Picture film. And you're going to see two actors on stage to make the presentation. We're going to have Warren Beatty and Faye Dunaway. And the whole incident evolves over just a couple of minutes. We're going to play about a 30-second extract of the award being made.
And the Academy Award for Best Picture.
You're impossible. Come on. La La Land.
And there we go. That's the critical incident. And if you don't remember what happens over the next couple of minutes, what's actually happened there was that they've read out the wrong envelope. They've been given the wrong card and they've made the award to the wrong film. Now, we might think to ourselves, this isn't really that big a deal. Nobody's been hurt. Nobody's died. There isn't anything here that we can undo. But it certainly was a big deal for the Oscars and for PwC, who are the company who run the voting process behind it. And the way that it was reported in the media, as you might imagine, the headline there uses words like fiasco. The reporting around it calls it crazy, improbable, downright embarrassing. I'm certainly willing to predict that it had some fairly major impact on the career of the people who were directly involved in this. And the question that the media asked, and I should imagine one that the Oscars asked as well, is who's really to blame? And that's a question that sometimes crops up in healthcare investigations as well. I'm not going to directly answer that just at the moment. We're going to park that and just keep that question in the back of your mind for a few minutes. Let's unpick things a little bit. We've got four key players involved in this workplace process. The actual voting and the handing out of the cards is run by PwC, an accountancy firm, and they've supplied two accountants to the Oscars ceremony. Got a chap called Brian Cullinan and Martha Ruiz. They are the only people in the entire world who know the contents of those envelopes. They've run the whole voting process, collated the results, and produced the award cards. And each of those two individuals has got an identical briefcase containing a complete set of the award envelopes. And it's run that way so that the stage director can bring the presenters out on either side of the stage. So what's just happened backstage in the run-up to the video that we've seen is that Faye Dunaway and Warren Beatty have approached Brian Cullinan. They've been given the award card. They've gone out on stage. They've read it out. And what we've seen unfold. What's interesting is if you keep watching the video for another couple of minutes, the correction happened during the acceptance speech made by the directors of La La Land. They're the ones who actually tell the Moonlight team that they have won this award. So the recovery from this incident wasn't as smooth as perhaps we might have hoped for. We can look into this because we've got a surprising amount of information in the public sphere about what's going on. This is the scene on stage just a little bit before Warren Beatty and Faye Dunaway are on. This is Emma Stone being given the Best Actress award for La La Land. This award's been made by Leonardo DiCaprio. He's come out from Martha Ruiz's side. He's got Martha Ruiz's Best Actress envelope in his hand at the moment. Brian Cullinan also has a copy of the Best Actress card. What he's supposed to be doing at this stage is putting it out of reach, destroying it, hiding it, but certainly not putting it in the hands of Faye Dunaway and Warren Beatty. And we do know a little bit about what he's doing just at this stage, because this is a picture of him. This is more or less the time that Emma Stone's out on stage. And if we look, Mr. Cullinan is the chap in the bow tie on the left-hand side of the image looking at his phone. Look very carefully what's underneath his arm. You might see there's a little pile of red envelopes there, and that's going to be very relevant to us in just a few moments' time. It's also important that he's on his phone because we know what he's doing on his phone at the moment because he tweets this image. I believe that he's been warned about using his phone at previous award ceremonies, and his employers have told him not to do this. And it's relevant to us from a human factors perspective because distractions are a psychological problem for us. It takes you a little bit of time, having been distracted from a work process, to reset your thinking and get yourself back on task. When you're put under pressure like that, it affects your decision-making and it affects your vigilance. And it's around about this time that Warren Beatty and Faye Dunaway arrive to be given their card. Mr. Cullinan has to provide them with a red envelope. What's the nearest red envelope to him? Well, it's one that's been put under his arm. But I would imagine that the envelope he's supposed to be destroying has been tucked under his arm when he's been distracted, and this is the one that he hands out. This is where the mistake actually happens. If you're minded to blame people, it's not looking great for the accountants just at this point. If we were the investigators, we could draw a line under this and say, yep, they've stuffed this up. Look at the terrible consequences that ensue from it, and we're going to punish them. It might not entirely shock you if I say that I don't support that idea, and I think that's a very superficial analysis of the problem because there's a whole lot more going on here that we need to look at if we're going to produce an informed report and robust recommendations at the end of it. And the first thing I would draw your attention to is let's just look at this as a work environment. Let's think about what it takes to work in an environment like this. Because if you take the aviation example, aviation is the root of much of human factors understanding in healthcare. And they have a policy of a sterile cockpit during critical phases of the flight. And what that means is that there should be no distractions and no conversations that are not related to the task at hand to minimize that risk of distraction. And I would ask, has the Oscars supplied a sterile environment for that worker to operate this safety critical process in? And no, they haven't. There are very clearly a number of distractions going on. So we're putting them in an at-risk position. That's us as people with managerial responsibility to think about. There's also an important thing called the substitution test, which is if you put someone with similar experience and background in that same position, would they make a similar decision? Now, okay, he's been warned about using his phone before. This might be a bit of an issue, but realistically, wouldn't we all be tempted to pick up our phones at this point? So I'm not sure that there's any individual issue going on here. That means we've probably got a systems problem we need to think about. There's another important thing for us to recognize is that the accident hasn't actually happened yet. The accident is still a couple of minutes in our future, and that means we've got an opportunity to rescue this situation, prevent it from happening. As long as the people on stage recognize they've been given the wrong information, we can still halt the process. Now, obviously that doesn't happen, and let's think about why that might be the case. So we're going to replay our video here, but this time I've dropped the audio a little bit because what I'd like you to think about is the body language and the relationship between our two presenters. Because I think you'll agree with me that Warren Beatty, knowing what's about to happen, he does not look comfortable with this situation. He looks uncertain. He's hesitant. He looks in the envelope a second time. What's missing? I'm not sure what's going on. Now, she thinks he's playing it for laughs. She says, "You're impossible." And I think that betrays something quite important, that they've both got very different mental models. They've both got different understandings about what's going on in this situation. I think Warren Beatty's handed that envelope to her, and what he wants to happen is that he wants her to cross-check the information. He knows that something is wrong, but he doesn't know what it is yet. Please, can you look at this and tell me what your understanding of it is? But because she's operating with a different mental model, she thinks that she's just been given the honor of making the announcement, and she reads out the name of the film. Now our accident has happened. So our team haven't taken the opportunity to prevent this because they weren't certain that the information that they were given was incorrect. And why might that be the case? Well, let's look into that. They have the confirmatory information that they need. It's on stage with them because the envelope, this is a recreation of it. I've color matched it as best I can. The information is available to them because the envelope says this is for the best actress in a leading role. And they don't see that. Possibly because the writing's on the front of the envelope and you tend to open it from the back, so it's not positioned in a place that's available to them. But even if they could see it, they've picked this color scheme because it looks luxurious and high end, but it's a very, very low contrast ratio. This text does not stand out. I'm a bit of a nerd and I tested it. The contrast ratio on this is 2.5 to 1. And if you were designing for accessibility on a web page, for example, your contrast ratio should be at least 7 to 1 or better. So even if they could see it, it's not being presented in a way that's accessible. Now, put them under heavy stage lights, it's going to be hard. I believe that they're both in their late 70s or 80s. I don't think they're wearing reading glasses. It may be that it's actually quite hard for them to engage. So we're not thinking about their needs in this process. That's the first of our faults in this envelope. But look at the card itself. We also have a problem. Now you look at that and think, there are 9 words on this card. How far can it go wrong? Actually, quite a long way. English speakers will tend to engage with written information by starting at the top left, moving to the right, come down a row, left to right, come down a row, left to right, forms a Z pattern as they scan across it. We can manipulate that to give information prominence or indeed to de-emphasize information. And if we think about that Z pattern in this particular card, the information given the absolute top priority, most prominence, is the Oscars. I'm going to suggest that if you've been down that red carpet, past all that paparazzi, amongst all of your peers, you probably know you're at the Oscars by this point. So we're wasting the most prominent place to put important information by titling it this way. Think about our Z-scan pattern. The next information that we encounter is Emma Stone. And I think this is maybe the point where Warren Beatty starts to look particularly uncertain because he's expecting to find the name of a film and he doesn't get that. He hands it to Faye Dunaway. She's looking for the name of a film. What's the first thing that she alights on that's the name of a film? La La Land. And she reads it out. And that's a phenomenon called search satisfaction. It's very well recognized and it's a repeatable thing. Despite that, we've still got the important safety critical confirmatory information, best actress, but it's in the smallest typeface. It's at the bottom of the card where it's least likely to be encountered, and it's behind a strong linear feature. And that linear features do corral the way that your eyes interact with information on a screen or on a page. In a lot of ways, we might as well put it behind a brick wall. We've really hidden it because Faye Dunaway has found the name of a film. That's what she's looking for. She's read it out. She need read no further along that card to provide the information to complete the task she's been given. So our nine words on this are upside down. We have absolutely got the prioritization of information wrong. And that means our team cannot be completely confident that they're in a dangerous position. Now, there are lots of human factors things I could pick out. I've picked out one in particular I think is important, is production pressure, because it's a feature that I see a lot in investigations that I have investigated. Incidents I've investigated, sorry. Production pressure is something encapsulated by the idea that the show must go on. All the preparation's been done. All these people are here to do the job. Do you really want to be the person that's going to stand up and say, stop? And you've got to be supremely confident and feel empowered to be that person. And production pressure can be put on us by our organisation. They might talk about waiting lists or how we mustn't cancel patients or the resources that are wasted if we don't complete the job. And that's obviously does put pressure on staff. But we also put production pressure on ourselves. And that may be just as simple as thinking, I've got to pick up the children from school this afternoon. I've got a date tonight. I've got a sports club meet tonight. I've got choir practice tonight. These are things that we do to ourselves to make us feel compelled to get through the work. And that can short circuit our decision making and can make us skip safety steps. And it's very well documented in industrial accidents. I first encountered the phenomenon reading the Rogers Commission report into the Challenger space shuttle accident. If any of you are of an age with me, you might remember it was late 1980s where NASA launched a space shuttle and it blew up shortly after launch. And when you look at that, the launch had been cancelled on several days, several occasions in the run up to the fateful day. And they kind of got to the point of saying, we've just got to get it off the ground. And tragedy ensued. So it is a real phenomenon that affects people's judgment. And I looked into it further. I used a technique called a fishbone diagram to categorize the various different components. And And I looked at things like the individual staff factors, age, eyesight, personal relationship between them. There is some history between them, I believe, based on the press, that they have had a fractious relationship in the past. There are team factors in that we weren't able to do rehearsals for this because part of the stage collapsed earlier in the day and they had to rebuild it, which truncated our ability to train the team. And I suspect, I don't know, but I suspect that there was no training about how to recover from an accident like this. Even if they had noticed that they had a problem, there was no functional way that they could communicate between the team backstage to confirm this. So they would have had to do it live and in public in front of an audience of millions. And that's a task design problem, and that's a work environment problem. And all of these things contribute to us being in a position where a mistake happens. So I think if we come back to that question of who's to blame, is it fair to single out the accountants in this? Well, no, I don't think it is. Because there are any number of other contributors to it. Yes, they made mistakes, but that's only one hole in a big Swiss cheese of problems. And I think as managers, we might choose to ask, is it effective to single out the accountants? And I would say again, emphatically no. Because I think that this quote from Don Norman summarizes it very, very nicely. If you change the people without changing the system, it's going to recur. Because the next team you put in the same risky situation are liable to make exactly the same decisions. Because it's not about the individuals, it's about the work environment and the policies and the equipment we provide them with. And we need to make sure that the next team are better empowered to make a different decision. If time permits, I can tell you a little bit about what the Oscars actually did and my thoughts about that, but I don't want to intrude on people's opportunity to ask questions, and I appreciate we only have a few minutes left.
Told you it was good, didn't I? Didn't I tell you it was good, everybody? Would anybody like to ask Paul any questions?
I've got no questions, but I'm intrigued to you to carry on the conversation.
Okay, so one of the first things that we should look at in these sorts of things is the design of the task suitable for the work environment that it's being conducted in. And something that I'm quite keen on is looking at complexity in workplaces. My PhD research was about mental workload, so it's a hobby horse of mine. But we as humans are not very good at reducing complexity. Our response to incidents tends to be, let's add another check, let's add another bit of paperwork, let's get another team involved in this. And that carries side effects. What the Oscars did in this situation is we've got a task that involves 2 complete sets of briefcases to give the director flexibility. You could say, I'm going to reduce complexity, I'm going to delete one of those briefcases, and that way you've engineered this problem out of the system. You could not have a recurrence of this event if you deleted one briefcase. It's not what the Oscars did. What the Oscars actually did was they put a 3rd briefcase with another set of duplicate cards in the production booth. And to my mind, obviously I wasn't part of the discussion around this, I don't know what the rationale was, there may be one. But to my understanding of it as an outsider, that's a terrible decision, because what it does is it does nothing to stop this from recurring. It might make it easier to diagnose the problem. It might make it faster to recover from the problem, but it doesn't prevent it. So I think what I would have done, if I did the choice, would be either delete a briefcase or have some sort of comms between the people, an earpiece or something like that, that allows people to signal they've got a problem. My preference would be the deletion one, because I'm all about trying to engineer it out. Any solution to a problem that relies on staff training is intrinsically not robust. And it's not because people are idiots. It's because that people are time pressured in a high stakes environment and they've only got so much memory capacity. So we should be using tools and equipment and decision aids to reduce that burden, not to increase it. That's my philosophy when it comes to looking at incident responses.
Well, I must say, anybody needing any kind of anesthesiology performing on them, I know how I want to do it. It's straightforward as that, really. Don't you love the fact that we take that Paul takes something completely unconnected with health and social care, and yet somehow I know what's going on in all of your minds right now. You're all fizzing with, I can just see exactly how this is applied in my own personal working environment and so on. But the processes, I would suggest, Paul, are completely the same. And I love the forensic manner in which you just unpick this. It's an absolute masterclass.
you.